This fungal infection is spreading at an alarming rate through healthcare facilities across the nation. That's according to a new report from the CDC.
The agency says the number of cases that actually caused infection nearly tripled during the pandemic. Fox 5's Joy Dukes explains the concerns that health experts have, especially for immunocompromised people.
Experts I spoke with say Candida auris isn't much of a concern for healthy people, but it poses a major threat to people dealing with an illness because of how rapidly it spreads and how resistant it is to even the most highly recommended antifungal medications. The CDC has issued a warning on a rapidly spreading fungal infection that's been identified in more than half of the states across the U.S., including Georgia. Officials say Candida auris was first reported in 2016, but saw a 200% increase in cases during the pandemic.
What's interesting is a lot of the same populations that we were really concerned about with COVID-19 are the same populations we want to extend extra care when it comes to Candida auris.
Medical microbiology expert Dr. Amber Schmidtke says it's a big concern for immunocompromised individuals, especially those in hospitals, nursing homes, and other long-term care facilities.
It's something that primarily affects folks that have underlying medical conditions.
Dr. Karen Norris of UGA's Center for Immunology and Vaccinations tells Fox 5 that concern stems from how easily Candida auris spreads and how resistant it is to three of the most common antifungal medications.
So that is very, very concerning because then it really limits the ability to control the infection in individuals that are already susceptible.
Norris says researchers at UGA are currently working on a vaccine that has shown signs it could treat the fungus. It's still in its early stages of clinical trials.
So our vaccine is, we call it a pan-fungal vaccine, that it hits three of the most prevalent types of these infections.
While the CDC says cases overall remain low, officials say they are working with state and local health agencies, healthcare facilities, and clinical microbiology laboratories to ensure they are using proper methods to detect and prevent a potential spread. Experts say practices like hand washing and cleaning healthcare facilities will also help prevent the spread. In Atlanta, Joy Dukes, Fox 5 News.
Joy, thanks.